Hi, my name is Kelsey, and I decided to do my presentation on strokes. To start off, what is a stroke? A stroke is a life-threatening condition that involves the brain, and it's when the brain does not receive enough blood flow or a blood vessel bursts in the brain. When there is not any blood flow in the brain, your brain cells start to die from the lack of oxygen. You can see in the photo that the normal tissue of the brain shows no abnormal flow in it. And when you're looking at a CT scan with a stroke, it shows an indication of abnormal tissue. There are two types of strokes. The first one is ischemic stroke, which is 80% of strokes. And the second one is a hemorrhagic stroke. An ischemic stroke is when the cells do not receive enough blood flow, which causes the lack of oxygen. This blocks the blood vessel by cutting off the blood flow, and it can happen by clot formation, a fragment from a clot somewhere else in your body that breaks off and travels up to your brain and puts the clot there. It can also happen by small vessel blockage from untreated high blood pressure, high cholesterol, or high blood sugar. The second type, which is a hemorrhagic stroke, is when there's bleeding in or around your brain. This is when an artery leaks blood or an aneurysm bursts. Leaked blood applies pressure on the blood cell, which causes them to become damaged. And this can happen by bleeding in the brain, bleeding in the subarachnoid space, which is the space in between your brain and the outer covering of it. The causes of the strokes: for an ischemic stroke, it can be caused by atherosclerosis, clotting disorders, atrial fibrillation, especially if someone has sleep apnea. It is also caused by heart defects, microvascular ischemic diseases. Hemorrhagic strokes are caused by high blood pressure, brain aneurysms, or brain tumors. And other causes of both these strokes can be an overuse of alcohol, high blood pressure, high cholesterol, migraine headaches, type 2 diabetes, and smoking. There's also another type of stroke, which is a mini stroke, and that is a TIA, which is a transient ischemic attack. This stroke is temporary and the effects don't last totally long, and it's also known as a warning stroke. If a patient has one of these, it's very hard to tell if your symptoms are from a TIA or if they are actually a major stroke. It's also often caused by blood clots, and a third of people who have a TIA do not get treatment. And since they don't get treatment, this can lead to them having a major stroke just within a year. Symptoms of a stroke: if a patient has one or more of the following listed, then it would be a stroke. They include paralysis, loss or difficulty of speaking or slurred words, loss of muscle control on one side of the face or your body, sudden loss of your five basic human senses, which are touch, hear, sight, smell, or taste, dizziness and vertigo, nausea and vomiting, emotional change, confusion, seizure, amnesia, headaches, and fainting. There's an area in your brain that's called the Broca's area, and this is when someone has a stroke and they have slurred words or have like trouble speaking. It's because this part of your brain is what controls the muscle in your face and your mouth. How is it diagnosed? There's two ways a stroke can be diagnosed, and those are imaging testing and blood or heart testing. For imaging testing, CAT scans are used, which are x-rays that take a clear and detailed image of your brain, and this shows if there's bleeding in your brain or any damage to your brain cell. An MRI is also used, which is magnetic, and the radio waves connect pictures of your brain. This can detect brain tissue or cell changes. Other tests that doctors use are tests that look for narrowed blood vessels, aneurysms, or tangled blood vessels. For the blood and heart testing, for blood testing, doctors will test your blood, the platelet count, and glucose level, and this helps to see if blood is clotting or they look for your muscle damage. An EKG detects heart problems that could cause a stroke. Atrial fibrillation or a heart attack will be shown on the EKG. The third one is a spinal tap. This is when the doctor takes a needle into your spine and collects the fluid around it, and this shows the broken down blood cells that are found. Warning signs: if you notice that someone is possibly having a stroke, these are the 4 things you should be doing. The first thing is you see if their face is drooping or if they can't use half of their body. You also want to ask if they can raise both of their arms to see if it's affecting one side of the body. You also want to ask them to speak and if it's slurred or if they have jumbled words or they just can't speak in general. And timing is very important with a stroke. The faster you call 911, the better. Treatment and medications. For an ischemic stroke, the medication used is called a TPA, which is tissue plasminogen activator. This is what they use to break up blood clots, is also a blood thinner, and it should be given within 3 hours before after your symptoms start. If they can't get you within the 3 hours, they will give you aspirin, which is a blood thinner as well. Medical procedures that are done for an ischemic stroke are a thrombectomy, and this is when the doctors go in, remove a clot with a catheter and a stent, normally in your groin. The second medical procedure is a carotid endarterectomy, and this is if a stroke is caused by a carotid artery disease, and this is when doctors go in and remove the plaque from your carotid artery in your neck. For a hemorrhagic stroke, the medications used are blood pressure medications, and this will just help take strain off your blood vessels. If the patient is on a blood thinning medication, they will be taken off of it before any medical procedure is done. The medical procedures done for hemorrhagic strokes are aneurysm clipping, which blocks your aneurysm and from the blood vessels, a coil embolization, which is when they block the blood flow and seal an aneurysm. 2 other procedures that can be done are a blood transfusion or surgery to temporarily remove part of your skull. Rehabilitation. This is a major part of your recovery. You will have 4 different therapies. You'll have speech therapy, physical therapy, occupational therapy, and cognitive therapy. Speech therapy helps you regain language and speaking abilities. It improves control of the muscle to help eat, drink, and swallow. Physical therapy helps learn to reuse your arms, hands, feet, and legs again, and it helps with balance issue and muscle weakness. Occupational therapy helps retrain your brain, improves hand movement and muscle control, and then cognitive therapy helps with your memory loss and focus and concentration. How can a stroke be prevented? You can improve your lifestyle by being more physically active and just eating better. You want to avoid overuse of alcohol, avoid smoking, manage health conditions such as obesity, blood pressure, and cholesterol. And a person wants to have a yearly checkup appointment with their doctor just to see where their cholesterol and all their other vitals are. Effects during exercise. Stroke patients have lower maximum workloads, and oxygen uptake is greater than healthy individuals because of the reduced mechanical efficiency. Stroke patients can have post-stroke fatigue, and this happens in 39% of the patients who have had strokes. This makes physical activity very difficult because they become tired very fast. Blood thinners are also something to watch out for if your patient's taking them because it can lead to excessive bleeding. For my case study, I chose Gina as a 54-year-old woman who went to the ER 6 months ago and with left-sided weakness in her face and was unable to speak. Gina is a non-smoker but drinks alcohol daily and is overweight. She has no medical history and is not prescribed any medication. At the ER, she had a CT scan which showed a large vessel obstruction showing that she had an ischemic stroke. She had a medical procedure done and the doctors were able to get the clot out, and now she can speak and move the left side of her body. After finding out she had a stroke, her goal is to cut back on drinking and start exercising to get in a better shape. Gina will now be on aspirin, which is a blood thinner, and she'll get baby aspirin. When exercising, she needs to make sure her BP stays within normal range and watch taking the aspirin while exercising. She will also get ECGs done with a follow-up visit with her doctor every couple months. For her exercise prescription, she should be doing 4 different prescriptions. This includes aerobic, which should be 3 to 7 days per week. It should be 40 to 70% of her peak oxygen uptake and 20 to 60 minutes per session. And then she should She should be focusing more on her large muscles, which she can do by walking, treadmill, and stationary cycles. For strength prescription, she should be doing 2 to 3 days a week with moderate intensity. Each set should be about 1 to 3 sets with 10 to 15 reps, and she can be doing circuit training, weight machines, use free weights, or isometric exercises. For flexibility prescription, she should be doing this for 2 to 3 days a week before or after she does her aerobic and strength training. She should be stretching to the point of tightness or slight discomfort and hold the stretch for 10 to 30 seconds if possible. The types she can do are static, dynamic, PNF stretching. The last prescription she should do is neuromuscular, which is 2 to 3 days a week, and she should be doing this the same time she's doing her strength training. This will help with coordination and balance activities. Modifications while exercising. Light moderate exercise if the patient cannot perform their graded exercise test. Specialization programs for those with post-stroke depression, fatigue syndrome, or motor defects, just so it helps them feel more comfortable with what they're doing. If there are any issues with the family support and social isolation that the patient is having, it needs to be addressed and solved. A survivor of a stroke with neurological deficits and emotional barriers requires a safer exercise program. My conclusion of this whole presentation: after doing the research on strokes, I have realized that warning signs are not talked about enough. My mom works in a hospital and just started working with stroke patients. It's very interesting how many people are in the hospital a day with a stroke. This presentation gave me more of an insight on what my mom does to her day to day at her job. I think it is important for people to learn more about strokes and what to do if they notice someone showing symptoms. I also know someone in my family who had an aneurysm burst while they were driving, and she had no idea she had one, and all her symptoms were horrible, like migraine headaches. From talking to her about her recovery, she had no idea what happened, and she lost a lot of her memory in the hospital. It took her around 6 months to get out of the hospital after therapy and other rehabilitation. I think that people should be getting checked and should be taking the right steps to prevent a stroke from happening. And that is everything. Thank you and hope you enjoyed.